So with that, I think I will call the TV studio. You ready? Okay. It is 9:04 on Thursday, August 11th, and I will call the August meeting of the Personnel Bargaining Committee meeting to order. I certify that open meeting law requirements have been met with proper posting. We have an 18-item agenda. Any corrections or additions? Other than
lunch break maybe at item 8.
I am going to propose we move the item 11 up and do that at after number 5. So we'll have a discussion there. Any other comments? Otherwise, look for a move to adopt.
Move to adopt.
I'll second.
Johnson and Nutter. All in favor, say aye.
Aye.
Opposed, same.
Are we missing anybody from this committee?
They're too virtual right now.
Oh, okay.
So, opposed, same sign. Motion carried. We have the minutes from our July Personnel Bargaining Committee meeting. Any corrections or additions?
Move to approve.
Move to approve, Austin. Second, Johnson.
Second.
You beat ya. All in favor, say aye.
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 Opposed, same sign. Okay, motion carried. So, item number 5, Employee Achievement Program, contract renewal for discussion, possible action.
All right, we have Gina Krieger with us here today from Real Living. Our contract is up for renewal at the end of this year with our EAP provider. So I'm actually going to turn it over to Gina, and she's just going to give this committee a brief overview of the services that are provided to Trempealeau County through our EAP and what our contract renewal looks like for either the next 1 to 2 years. So Gina, take it away.
Excellent. Hi, thank you for having me today. I'm excited to share with you a little bit. I am going to go ahead and share my screen so that you can have a visual as well as me quickly talking through. Hopefully you can see this okay. I wanted to briefly review all of the things that make Real Living stand out as an EAP provider and just remind you that we're called an Employee Achievement Program instead of an Employee Assistance Program. And we take that very seriously. Our passion and our mission is really to help your employees be their best. And sometimes that means being their best at work. Sometimes that means being their best at home. But you get to decide what your best looks like. And we feel like it's our privilege to help you get there. So one of the things that makes us stand out from other employee assistance programs is that we have a live answered call center 24/7. When your employees call, they talk to an actual person. It's not a phone tree. It's not a automated system in any way. We're local. We're based out of Menominee, Eau Claire, and Chippewa. We're just a few minutes away. If you ever need anything, we can be right there. We provide proactive, solution-focused publications to internally touch 100% of your employees. Most EAP services reach out to 3 to 5% of the employees, and the 3 to 5% of the employees that use employee assistance programs are usually in crisis. So the national average is that about 3 to 5% of employees are in crisis, therefore use the EAP. We try to touch 100% of the employees by being proactive and trying to touch people all the time with publications. We provide immediate crisis response, as I'm sure you're aware, either in person or virtually, or sometimes just sending educational materials. We offer leadership university courses to enhance skills. We recently just finished one in Trempealeau County. We offer professional coaching certification courses to enable you to select people right from your county to be a professional coach using the Real Living tenets. We provide organizational advancement in case you have a team or a department that's not performing at the top of their game. We can come in and try to help give solutions to get the organizations back to being their best. We also provide conflict mediation for individuals that aren't getting along. And these are all a little bit different techniques than many of the other EAPs that are out there. So we really try to be, as it says on the screen, simple, commonsensical, real professionals with a passion to help employees be their best. As you may or may not know, we offer our supports in two different modes, a membership plan and a partnership plan. And so I added to the sheet, you maybe have an opportunity to get one of these worksheets. I think Krista was going to print some out. So because of your excellent utilization, as I said, the national average is about 3 to 5% utilization nationwide. And your utilization for Trempealeau County is 10.5%. So that's really impressive. Your people are utilizing the services, and that's what we love to see. People are very engaged with Real Living. The terms of your renewal is that you can have a 1-year renewal with a 4% increase in rates, which would move your annual cost under the membership plan from $9,100 to $9,464 annually. Or the second option is if Trempealeau County would consider signing a 2-year renewal, the cost would be $9,500 annually for both 2023 and 2024. So it kind of sets the price without a increase for the next 2 years. We are serving just over 16,000 employees in our EAP right now. And as I mentioned, we have a membership plan or a partnership plan. The membership plan is all inclusive with all the different ancillary services and the face-to-face or direct services included in the price. The partnership plan is all the ancillary services, which I'm about to share with you, and then you pay per service for the direct services. So, all of the services you can see on the screen, counseling, 4 sessions renewed annually, and in a membership plan, that price is included. In the partnership plan, we bill $125 per session. So as we go down this list here, you can see all of the services that we provide and what it costs in a membership plan or a partnership plan. You currently have the membership plan, and as I mentioned, you're at 10.5% utilization, which is excellent. So something that started new in 2022 was that employees are allotted 4 sessions with a counselor to be shared with their immediate family, as well as 4 sessions of professional coaching. So instead of getting just 4 sessions to use between counseling and coaching, now employees have a total of 8 sessions, 4 to be used for professional coaching and 4 to be used for counseling. The difference between coaching and counseling is that counseling is recommended for personal issues that are affecting people's work. Professional coaching is used for professional issues that are getting in the way of people being their best at work. Employees get legal or financial consultation. They get a 30-minute consult with a lawyer or a financial consultant for each issue that they come across, and then those are renewed annually. We have a specialized system for emergency services workers, which again, Trempealeau County is very familiar with. We have crisis response, as I mentioned, for groups or individuals. Our call center staff is trained in crisis response. So if somebody calls the call center looking for services, a call center specialist will be able to handle even the toughest crisis. I mentioned conflict mediation services involving 2 or more individuals. Management consultation. Every supervisor or leader is able to telephone or email an account champion and get assistance with everyday issues that come up as a leader. And those are all included, as well as 2 on-site training sessions for Trempealeau County. The ancillary services are all of the membership brochures, the posters with business cards, the brochure libraries that hopefully you've seen around Trempealeau County, the 24/7 call center, the wellness newsletter that comes out each month, along with the Friday Facts that comes out weekly. We have a quarterly wellness newsletter, a Champions of People that comes out monthly, and that's meant for leaders and managers, or what we call Champions of People. The Real Living magazine that comes out 3 times a year. And then we have the website where people can get all of the different information that I just mentioned. Additionally, we share the 1076 to bestness with the emergency services personnel. And as I mentioned, we have some additional supports that are pay for service. In trying to explain more about Real Living Services, I want to see if I can share the 6-month utilization report. Marianne Erickson is your account champion. And like Krista said, my name is Gina Kruger and I'm the director for Real Living. And I just wanted to share the first 6 months of 2022. As I mentioned, your utilization, this is for the direct services, the coaching, counseling, as you can see here, is at 10.59%, which is well above the national average for direct service utilization. At this point, I'd like to open it up for questions. Does anybody have any questions or anything you would like to ask about our EAP service?
Questions from the committee?
I'm totally familiar with what they do.
I don't have questions. I'm glad we have it.
Thank you, Heather.
I didn't hear what Heather said.
She's
glad we have it.
Okay, thanks.
So at this point, the committee would need to make a decision if we'd like to do a 1-year or a 2-year renewal.
What have we done in the past, 2 years?
Yep.
Okay, I would make a motion that we continue with the 2-year contract.
Turn your mic
Oh,
on.
I'm sorry, thank you. I would
Play
make
with
a
it.
motion that we continue with the 2-year contract with Real Living and their EAP program.
Okay, motion made by Nutter,
I'll second that.
second by Johnson. Any further discussion on our EAP program with Real Living? Hearing none. All in favor of a 2-year contract, say aye.
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 Did we hear John?
I heard John.
Oh, Heather's not
Heather
there.
just stepped away, but opposed, same sign. Yeah, we'll ask her. Heather, you in favor of a 2-year contract with EAP?
I'm in favor. I'm sorry, my boys got into it over here.
Understood. All right, thank you. So motion carried. We will begin a 2-year contract with Real Living. Thank you, Gina.
Thanks, Gina.
Yay,
Gina,
thank you,
see-
you guys.
See you at WCA.
Okay, we'll see you there. Thank you.
Okay, so our next item we are going to address, we're going to talk about item 11, merging of county human resource departments for discussion, possible action. And before we get into it, I do want to say that we're all here for the best interest of the county. I expect it to be civil. I understand this may not be an easy discussion, but it's still worthwhile to have a discussion. There's nothing wrong with talking about this. There's no guarantees anything will happen, but we can talk about it. So with that, I don't know how to start with this. I approved it being on the agenda, but I did not bring this forward. So I think, Riley, would you be willing to discuss why we're here and what you'd like to bring forward?
Yeah, I can talk about it. It's come to my attention on how this is all working out on with the healthcare center versus the rest of the county. I keep hearing this saying that it is its own identity, that it's its own thing, but yet it's underneath the our county taxes. So in my research that I have found, the healthcare center is part of the county. It is a department of the county. We need to adjust everybody to be in the right departments where they belong. So having the healthcare has its own HR department. Well, why do they get to be favored having their own HR? Where no other department in the county has that. So I brought it up to Kellen. I've talked to other board members as well that we should move the HR and the finance, the treasurer departments to the correct departments where they belong. Not saying we're getting rid of nobody. That is not what we're doing. We are just rearranging to make it even across the board. That is what the goal of this, and that's the way it was coming across. That's the way I looked at this for everyone's. So with that being said, that's kind of why we're here. We were trying to make it clear, no black, no gray. We want black and white across the board for everyone. So everyone's held accountable no matter what. That is where I come from. That's how I've come across with this.
So could you just be more clear to me on what you mean? I mean, I think merging the two entities is over 600 employees, maybe. So are we going to create a whole new HR department for the county that will handle highway, that will be able to accommodate the 600 and some employees that are involved in HR?
We're not getting rid of that person. We're literally just taking them
No,
from.
but I mean, can one person or two people handle HR for 600 and some people? If you merge the two entities, the county here and the health department, that's over 600 people. So I'm just
Jeannie, they
curious,
have their-
are we, wait, could I finish, please? I'm just
Sure.
curious, are you talking about creating a whole new HR department for the county? Because I don't see
We-
Krista handling 600 and some people.
We have an HR department, Jeannie. What we're doing is taking that person and putting her under her department and leaving her.
Okay, so there'll be.
That's all this is literally we're just transferring the person that does the work
Okay.
already out there to the correct department where they belong.
Okay, I just.
That's where I'm coming
Okay,
from. We're not creating into something brand new. No,
Well,
no,
I
we're
think
just,
you would have to create something new because HR policies, I don't know.
No,
I
this
think-
person specializes for that facility.
Okay, I
That's
just
because
don't.
I know there's other with being in the medical field, there's more work to be done. All we're trying to do is align everything across the board, so
Okay,
it's
but
even.
I don't think it's in either budgets right now for this year to make that change. Because budgets are up right now.
But this is where we're talking.
Okay,
This is the whole point of this, is to discuss things
okay.
and
I
try to
just
figure
didn't
out what's
understand.
best for the county moving forward.
I just didn't I foresaw a whole new HR department.
No, we're not making a whole new HR. We already have an HR department. Why would we go ahead and make a new one when we have one? We're just moving one person to the correct department.
Jerry, would you like, we'll invite the,
Mr. Chairman, may I speak?
you sure may.
Just a second here.
I
Do we
think-
have a human services quorum right now?
I don't
There's
believe-
you, me, Heather,
But
Ron.
it's on the back of the sheet. It does
Okay,
speak to
but
that.
I mean, there is some, you said something about there's a thing
Right,
about
I
who
was-
can speak and who can't. If
Okay.
there's when a quorum of another,
Yeah, it does speak to that on the back
maybe
of the
Rick
sheet.
could answer my legal question here about how to proceed when there's a quorum of another.
It's a really gray area, and we got to be careful with it. But board members are allowed to are allowed to attend other committee meetings and observe what's going on. Where you get into the issue is when you start participating in the meeting and you're conducting business essentially on behalf of the other committee that you're here. You're not. Again, it's a difficult thing to do because you're not necessarily here for the Human Services Committee, but you are present because you're a board member, and so it's a gray area. So we just got to be careful. Board members can speak if they're called upon. We just have to be careful that you're not trying to conduct business for the other committee as well. So again, it's not black and white. It's a gray area. So we just have to be careful. Board members are allowed to give input if they're requested to at a committee meeting where they're not a committee member. You just have to be mindful of other issues.
Just don't bring, just don't bring up any human services business.
Clear as mud, in other words, so.
Yeah.
So.
Okay, I think you're safe to proceed. Nick.
I almost lost my train of thought after all that. What is the major purpose in this suggestion? I guess and maybe I missed that, I'm still doing audit upstairs, so I was listening. John had the screen on. But what is the goal, or what's the major gain in consolidation?
Well, for me, it's for accountability for everyone. How can we have accountability when we have an identity that they say they are, but they're not? They're part of the county, and yet we don't know anything that's going on over there for the rest of the board members. All we hear, I'm hearing a lot of negative things. I'm not sure. I just want to get it out on the table. We need to have this discussion and figure out what's going on.
And that's reasonable.
That's but to have it as with having their own HR and finances, it's not fair to the rest of the departments. With it, we're just trying to make it even across the board. Literally black and white. This is the way it is. We don't have any gray area.
Okay, I hear the word accountability. In terms of even, that's immaterial. But accountability, I do hear that. And as you know, Riley, you elected, as I did, 3 people to the Board of Trustees. And that does bring about some accountability. We do have 2 members who are from the public, and obviously, those people were appointed by the chair and approved by the board. So there is some accountability, if that's what you're concerned with.
Can I? Oh, sorry.
Let me finish, please. Now, if there are issues that come before individuals, obviously that should go to the Board of Trustees for consideration if there are some concerns. And you're suggesting that people have said things to you, possibly to other people, which is fine, which is good. But then that matter should come before the Board of Trustees. The accountability, I think, doesn't hold a lot of water, pond water at this point, if we utilize the system as it's set up. We're here, the people who have been elected and appointed are here to represent the board. I'm done for the time being, thank you.
It feels to me like we've skipped a spot here, and that is having this issue before the Board of Trustees first, before it comes here. Because their healthcare center, I mean, it really is its own thing. Granted, it is part of the county. I mean, you have a new building, there was a bond for that. There's no tax levy involved in that bond. It's paid for by the healthcare center. I mean, are we talking about taking on that bond too? And then the county, you're gonna put that on the tax levy? I mean, there's more to think about than just making this knee-jerk reaction, because I think some people, to be honest, and I'm gonna maybe make myself vulnerable here, but I think there are some members who are on this committee who aren't happy with the way some things are being handled. Like, you have to have a vaccine, you have to wear a mask to go into the building. You know, I mean, is that motivating some of this stuff? Are there personal issues? And I don't want to be making decisions for the county based on some folks' personal issues with the healthcare center. And if we're gonna be honest, then we have to have those honest discussions. And I'm going out on a limb here because, you know, that's me, that's my social work background, and people get sick of me hearing me say that, but that's where I come from. And we need to have honest, frank discussions about where this is all coming from. I mean, I think if we talk about merging things, we're going to be merging, are we going to take on the bond and have the taxpayers be responsible for that? I mean, there's a lot of, can I please just speak? Thank you. I'm not quite done yet. Well, this is a discussion. I mean,
Understood.
I hope we're not having a vote here.
No,
I hope
we
that
are
I can
not.
only say 3 comments.
The others have been asking also, and
But I
others
mean,
haven't said anything. So I'm just trying to respect
I just
everybody.
want people to understand, this is a bigger thing than just merging the health department. We're talking about bringing in your debt, bringing in, you know, you know, there's federal dollars that come to you, there's state dollars that come to you like human services. It is a big darn deal.
Okay, thank you. I want to go to, I know, Kim, you'd like to. Heather tried to interrupt Dick, and then Jeannie went in, so I want to give Heather an opportunity to speak, too. And then it'll be Kim.
Okay.
Everybody's going to have a chance to speak.
No, I know. I'm Lori.
I'm sorry. But Heather, you had tried to interrupt Dick at one point. What comments would you have to offer?
So I've gotten complaints from people in the community too, that the way that things are set up right now is that if they go to HR, these are people that used to work there that would love to work there again. If they go to the HR department at the healthcare center, they said that if the administrator doesn't like the complaint, he doesn't do anything about it and it doesn't go anywhere. And my issue with the healthcare center board of trustees is that we're only given information that's filtered through Jerry. And I guess if we're going to handle it at the board of trustees, which is honestly, yes, I agree, Dick, that's where it should be. I feel like we should be able to have the HR person from there come to us with any issues that have come up. Just like at the county, if HR has a complaint, they come to personnel and bargaining so that we have that accountability. Because right now, because right now, it just seems like there's a disconnect. And even if you have a really great administrator, it's hard to not be biased when you get complaints and want to share that with your oversight board. So right now it just feels like employees don't have the same accountability going to HR as they do in the county. And so that's what I would like to clear up is having this, having that board have the accountability. The employees aren't allowed to come and talk to just board members on the healthcare center committee. They're supposed to go through Jerry. And in the courthouse, last year we experienced it too, where people were having an issue they felt like with a department head, and that was able to be dealt with because it came to HR and then it came to the oversight committee because of that. Right now, if it goes to Jerry, we have to go on hoping that he brings it all to us. And it's just not always easy to do that, if it's not news that you want to share. I've got letters from people. I've got employees that have worked there before that would love to work there again, that were really good assets there. They're short-staffed. So I'm trying to figure out how can we better serve the employees there so that it creates a good working environment so that the clients benefit from it as well. Right now, it just seems like there's not the same level of accountability out there as there is in the courthouse.
Okay, so I want to give Lori a chance. She's been wanting to speak for some time.
So,
Microphone, please.
just a couple clarifications. We are not a department of the county. We are an enterprise. There's a difference. So I would just like to remind everybody of that. As far as the staffing, it would affect your budget quite dramatically. We have 2 people in our HR department, and if you also include finance, I have 5 staff in my business department, including me. And so if you integrate all of that, you've just increased your tax levy by the salary of all those individuals, because right now, tax levy is not used for any of those individuals, for either their payroll, their taxes, their benefits. None of those people are paid by the tax levy currently. So doing this for both the HR and finance department would be quite a burden that you are putting on your tax levy. As far as the finance part of it, we are healthcare, which is different than county. I agree with you that we are all on the same, we are a part of the county as an enterprise, but we are healthcare, different than the employees that work in this building. And so our payroll is intensive. You are dealing with shifts, our schedules, differential, overtime. That's the payroll part of it. As far as the finance, we receive, as Jeannie mentioned, federal and state funds through Medicare and Medicaid. And so your finance includes cost reporting. It includes a single audit for compliance that we have to issue separate audits to every single one of our 68 counties that we contract with on a rolling basis. So it would be quite a feat for this county to bring on an HR, payroll, and finance to the courthouse and not keep it separate.
Can I ask a quick question of her? Well,
You sure can.
Do they handle the finance, the payroll, I should say? Do they payroll as well as personnel?
Yes, we process the payroll. And so this is where we work very closely with Paul's office. We actually process the payroll, but then the reports are submitted to Paul's office, and he cuts the checks, to put it very simply.
Yeah, my question, maybe I confused you. My question is, do the personnel employees, the 2 people who work in personnel, do they act as payroll, handle the payroll in general? No. You do that?
We handle the processing of the payroll in our business department.
Okay.
HR does the employee matters, hiring. They work with the employees on benefits, but as far as processing those dollars, that's done under my department.
Okay. Thank you.
Could I just ask Krista to clarify that the Personnel Committee does not get involved in every employee issue that comes up, and explain how that's handled, because there are times when we aren't even aware of employee concerns?
Yep, so if it's for lack of a better word, frontline employee, usually I work with the department head or the supervisor in those matters. If it's a department head concern, our policy states that we now have a department head oversight work group, and those matters are now referred off to that work group for further consideration.
So those matters do not come to personnel?
Correct.
Okay.
That's it. I just
Nope,
wanted
nope,
clarification on that.
Heather?
Oh, okay. And I just want to clarify something. I've been getting a few people trying to say that I'm on some personal vendetta. Jeannie, I'm pretty sure you were talking about me with the whole vaccine and mask thing. And I would not be pursuing this or trying to open what feels like a can of worms if I didn't have many past employees coming to me asking if we can look into this and what we can do to make this better. And then because I'm on this committee and it's dealing with HR, I had other board members saying that they had been getting complaints from people too. And so it's really frustrating to be people making accusations and saying things. I don't have anything to gain from this, and I don't, it's not like I'm doing this for fun. It's not a fun conversation, as Kellen said. It's just something that I thought we need to have a conversation and try to figure out how we can better serve everybody so that the clients and the staff get the best services. I just also wanted to bring up that the highway is also an enterprise, and we work with them on that enterprise. The sheriff's office payroll includes shifts, and the county can charge the costs back to the Trempealeau County Healthcare Center. That's where, this may be another committee issue, where if you guys set up a budget going through the county, we work all of that out. It's just something to talk about. And I just wanted to dispel rumors. I had a pretty nasty post put up from an employee at the healthcare center as well, saying that I'm on some personal vendetta. And I really, if I didn't have so many people asking me to do something to help, I wouldn't be trying to do this, because it's not a fun conversation. It's just something that I felt like I need to bring this up, because I had many people approaching me, and so it's worth a discussion.
And I just want to clarify that I'm not targeting you as an issue, but I think the healthcare center has taken a lot of grief in the last 2 years about rules that they had to put in place about going into the healthcare center, that it is full of vulnerable people, and we just need to be safe when we go in there. And it's, and I think if you have all these letters and all this information, if other people have all these letters and information, they need to be shared at the health, the Board of Trustees.
I think that as we go through this, to me, it seems like we have two separate issues that are obviously related.
Clarify, the highway is not an enterprise.
I've been told that the highway department is not an enterprise. I don't.
It's not.
It is not a, so, Paul?
I can explain that part. No, highway is not an enterprise fund. They're an internal service fund, which means they get to bill for their services so that they come back to the county. So
but there are levy dollars involved with highway.
There are levy dollars involved.
Okay. So, I want to, so I think we have two different issues here, and both are valid and both are worth discussing. I'm not sure that we're in the right place or group to do that. One being general knowledge of the interaction and the workings of the healthcare center and how it relates to the county. I think that there would be value in going through how and why things are separate. And this is a whole board and probably just general knowledge idea. And that's something that would obviously, I don't know either. So that is probably a healthcare center staff in conjunction with probably Paul's office to explain how and why some of this stuff is set up the way it is. Because there's things that we don't know. Now, could that open a can of worms also? Of course it could. But that's still not a bad thing to have people understand why things are the way they are, or maybe there are subtle changes that happen. The second issue that I see and am hearing is more of a question of oversight, which I agree with Mr. Miller that it makes more sense that if there's those type of issues, that should go through the trustees and at least allow that to run its course with the people that we have chosen to represent that committee. So those are the two separate issues that I see. They're valid concerns. I'm not going to doubt Heather. I haven't had the same experience she has, but that doesn't mean that she hasn't had it. So it's worthwhile talking about it. I'm not sure that we're going to come to any kind of consensus of anything today. We opened a can of worms, and I do believe we need to keep digging into it. And just to learn first, and then go from there.
And I like what you're saying, and I think because we have so many new board members, it might be good for you all to come back to a county board meeting and maybe a special board meeting and explain everything. Because in regards to oversight, in my experience with nursing home evaluations that are done by the state, you are under tremendous scrutiny by the state for everything you say, do, and I know those nursing home evaluations can be rigorous, and they're a week long maybe, even in some cases where the state comes in and looks at everything in the nursing home and in your facility, and especially because you provide behavioral health issues as well as nursing home stuff and a ton of other things, that I just don't think all board members have that knowledge. And it's good to make decisions based on facts and knowledge and not hearsay. And you know, I've had a lot of disgruntled employees, not from the healthcare center, but from other departments, contact me, and some of it I think you have to really listen to, and I forward those on to Krista, the person that really needs to handle them. I am not micromanaging any department, so if I get a complaint about the treasurer's office or veterans or human services or Paul's office, anybody in his office, if Sam calls and complains, I refer it to Krista. It's not my job to micromanage the employees of this county. That's why we hire department heads and supervisors.
We'll go to Riley because he wanted to speak before I spoke.
Can I?
Hold on, Heather. Let me talk for a second. I understand that you guys are saying, oh, we're going to take on all this debt, all this stuff. How much money you guys get per year? What's your average budget per year? 26, 27 mil is what I've heard numbers. So what is that going to matter to us about our debts or our levy? You already have money. You guys have the money to be able to handle the everything. So I'm not worried about transferring everybody and worrying about extra debt because it's already there. The money's there. So I'm not worried about that. So where are we all coming up with like all this, you're going to take on such a burden? It's already there. Like, I don't care if it's less money, more money, I don't care. But the money is there to make you operate already. You're already operating. And it's not like we're coming up with a brand new idea and we're going to try to make it work. It's already financed. So the whole thing of you're going to take on a huge budget is irrelevant at this point because the money's there. The budget's already set. You guys are already going through a budget, per se. So it doesn't make sense to me when you come up here and say this.
It makes sense. I don't want my tax levy to be increased by adding 7 new employees, salaries, benefits. That'll all come out of tax dollars when we move it from the healthcare center to here.
Pays for it still.
No, not if it's under human services.
No,
please explain how you're financed.
So there again, this is getting into a higher level discussion that I believe we are not qualified to sit in here today.
May I bring it back?
What's that?
May I bring it back?
Please do.
Accountability, again, I'm going to go back to accountability. I think Riley brought that up, and I think Heather's bringing this up too. And that seems to be the major concern at this point. I'm not taking a position on merging or not merging. I'm not taking that position. Right. Accountability, I think we need to talk about. And just to read a statement, if I may, the Board of Trustees, this is from their bylaws. And this was approved by, did our group approve this last time?
Decades.
Okay, anyway, it's been in place for quite a while. The Board of Trustees shall adhere to the following guidelines, and I thought this was interesting. And I think this speaks to what you were talking about, Jeannie. The individual board members shall not deal directly with employees nor give them orders without authority of board action. And deal directly, that doesn't mean that they can't speak to people or listen to what people complain about. And that's what all of us do as board members. And then we bring it back to the proper places to talk about. And I think just to move into an area that we can possibly address is to, and I'll ask Corp Counsel this, if we want to discuss individual issues or complaints that come in, does that warrant, or can we go into closed session as a committee?
Depending on the need.
If we're talking about specific individuals and complaints and concerns.
Typically, if we're talking about current employee's performance issues, yes, those are issues that should be discussed in closed session.
Okay.
If it's a general complaint, and I'm just using this as an example, if someone's making a complaint against the healthcare center, it's going to depend on the nature of the complaint as to whether or not that would qualify for a closed session or
So
not.
it's somewhat judgmental.
To some extent.
Sure.
I mean, if it reflects on an employee's performance, clearly it would need to be in closed session.
Okay. I guess what I would think is appropriate is that as the Board of Trustees, we sit down and discuss the general thought of accountability, and then decide if we need to modify any policies that exist to make room for opportunities for discussion of individual concerns or complaints that come before the committee. And I respect Heather's desire to have a place for those. But I think it would be appropriate for the Board of Trustees to make a real significant endeavor to look at this area. The board here a few years ago, and you can tell me if I'm mistaken, but set up a procedure to handle certain issues. I don't know, what is it called, Crystal, where you... department head issues that...
Yep. So within our disciplinary action policy, we had created the department head oversight work group.
Okay.
Explain who's on that.
So that committee consists of the department head's oversight chair, the personnel bargaining committee chair, and the county board chair, and they work in conjunction with corporation counsel and HR.
Okay, but anyway, that's the avenue you chose to take. And, you know...
For department heads. Only.
Okay. So I don't think it's inappropriate for the Board of Trustees and administration, Jerry and his staff, to sit down and talk about generalities to start with, and decide if we would feel it appropriate to instate some type of new policies to handle these issues that come before us. That alone, to me, is not enough, at this point, is not enough to warrant serious talk about merging. I think the serious talk about merging should be based upon the overall benefit to the county, the overall benefit. And that would include the accountability, I suppose, the cost of operation, and all these things. Though I do feel very strongly, Riley, that when we have 350 employees there at the healthcare center, 2 people is not any too many, probably, to deal with those things, because I think over the years sitting on personnel here at the county, we tried to operate for a long time with 1 person, and they couldn't do it. They couldn't do it. And obviously we went to 2, and but it's a little bit different here because they handle insurance and some of the other facets that your people probably aren't handling there. They're specializing in personnel. But all I'm saying is 350 people with those individual concerns We have something coming up, as I understand. Executive Finance is privileged to this. Health insurance is always a major issue, and your personnel people handle all that, don't they? So they're working with each individual employee on that. So anyway, getting back to it, and I'll quiet down for a couple minutes. I think the Board of Trustees need to sit down and that includes Heather. I think Heather may want to say something.
We've got multiple comments. Heather, do you have anything to add right now? Heather, you tried to chime in before once.
Yeah, I guess, Dick, I think if we're going to look at that, we need to be able to have discussions with HR without the administrator as well, just like we have discussions with HR in the courthouse without every department head there, so that you can have an unbiased oversight like we do at the county. And I know that HR said that they've got the oversight committee, but I know that there also is usually mention of, possible big issues brought up at personnel and bargaining too, just so we're aware of them. Right now, it doesn't seem like we have that, we don't have that kind of a system set up. So that's something that I would like to look at, so that we make sure that we're getting a good, clear picture by being able to talk to those people who are fielding complaints or things like that, if that makes sense.
Could we get clarification? Well,
What?
I mean, we could go on all day trying to get
Right.
clarification, because I'm assuming you have a process similar to we in our,
Yeah,
go
Jerry
ahead,
would
speak.
like to speak.
So, actually, I keep hearing my name also, and things are fielded through me. That goes to the Board of Trustees. Actually, any concerns that are brought even to yourselves and so forth, our past practice have, in our previous board chair, Doug Winters, they would be given to him, and actually he, would any of those, again, would go to our HR department, and then as needed, I was brought into, or one of the executive team members were brought into the conversation. A lot of the Pigeon Falls ones are actually brought, Rose Tessing is part of that conversation with our human resource director. I know that we have two wonderful, just top-notch HR individuals, and I know that the weekly dialogue that Kim has with Krista is very, very therapeutic, and they're bouncing stuff off each other all the time. So that relationship is really good. With this being said, depending on the licensure and so forth, it depends on the executive member that's involved. Terry Summer might be involved, with the nursing home, myself with the IMD, we have other people, with the community. HR fields that, HR keeps track of that, HR investigates that. So, things that come through there, again, I would suggest getting those to Kim Klatt, and then she would take it from there. I mean, we have a process. Anything that comes to me, I mean, if, even with our recent surveys, Jeannie, being very knowledgeable of healthcare and so forth, we have so many state entities that oversee us with every investigation, whether, even with employee investigations, if there's something that involves a resident, so much of that is shared with the state entity. As recently, we had the federal surveyor, so it goes a step higher in one of our facilities. So there's a lot of oversight. But again, if there is something of critical in nature, HR, HR is involved. They field that, they screen that, and again, if it's critical in nature, that will be brought to the Board of Trustees.
Okay, Riley, I do want to wrap this up at some point, because we're going in a circle at this point.
Simple thing, more towards John Ozen. Mr. Chair of the County Board, I request that we bring this to the full board to be discussed on how the healthcare center is part of the county.
Could you clarify for me? I mean, you want us to vote on this at the
No, no,
board?
no, we're not voting. I'm
Oh,
asking him
you
to,
just
to
want
make it go to
information.
full board.
Okay.
Which is what I think
Like,
we
to
all
have
do.
an understanding
Okay.
of what's going on.
Yep.
Okay.
Of
The whole board.
what are they to the county? That's
Okay.
what I was going for.
Yep.
Like, we need to know, so everyone is understanding where everyone lies.
Yep, I think,
That's my request
I think
to the chair of the county board.
there's genuine interest in that, just given that I counted 11 board members already watching today. So this would be of great interest. Wholeheartedly agree, whether this is a regular meeting or something we do special, I suspect. But there's a lot of interest that I think that we'd all gain some knowledge from.
Yes.
I think
working
a
through this.
special,
Yeah,
I think a special meeting would be
appropriate.
good.
Just so we can clarify and clear everything up. Yeah, I know we opened up this can of worms. I want to get it resolved. I don't want to have this hinder any longer than, we have to. I just want to figure out what's going on.
And actually, you
That's-
brought,
understand.
you brought up
Just a
Pigeon.
understanding.
Yep.
You brought up Pigeon Falls, and I forgot about all
whole
your
other
other
facility.
little entities that are connected that people may not even be aware of.
Paul, did you have something you want to mention?
Said, I hope you don't do it for Monday night, but when you said a special session,
I
that's
think
better.
that's
I'll
probably
work
more
with
fitting to
John
do
on
something
that.
special, so,
We already have something special Monday night.
yes.
We'll work with Paul on something.
Yep, I think that would be the way to
Works for
approach it.
everyone for education.
Yep, because I think we all need to understand.
May I
Mr. Ozen, okay with it, though.
May
John?
I add something to
We
that?
don't care if he is or not.
John, I think John would probably, we can
I think we can
twist his arm.
there, yeah, go ahead.
But what I was going to suggest is a consideration, John, and that is that if we do have a special meeting, may it not be appropriate to, and I haven't talked to Jerry about this, and Jerry may kick me in the shins here before I finish up, but to invite us out to the healthcare center, and then he'd have a chance to present, some history, information about the programs and so forth, so that we all are better tuned into the programs and facilities there. He's got a very large staff that are working, he mentioned licensure, and a lot of very highly qualified people who have positions at the various centers and various programs. And I don't know, Jerry, if that would be appropriate or not.
Yeah, I did do a presentation, pre-COVID, for the full county board with all of the licensures, all of the programs and so forth, and the executive team, leadership team and so forth, and we can sure look at that. I do want to be respectful of, again, it's not about me, it's not about any of us in this room, but I do want to be respectful, of the clientele that we serve, for not only privacy, but also for COVID-related things going on right now. Trempealeau County being in a high risk. We have, one facility, one unit under quarantine right now because of positive COVID, which every facility does. So I want to also be respectful of people, coming into our building, that at this point, we have, visitor policies and we have staff policies. So again, even, some examples, yesterday I was going through the hall and there was some people that came in, and some of the residents says, can you please ask them to please wear their mask, and thanking us for trying to get people vaccinated to protect them. So I'm going to continue to advocate for that, but it's something that we can definitely look at.
Better to meet here.
Huh?
Better to meet here
You know.
than bring all of us there.
Yeah, it may be.
You know-
The advantage, Jerry, too, here, as I think about it, is that we have, it would be available online as well as on television, so that maybe the community would have a chance to be better informed, too. So I, thank you, Jeannie.
Yeah, I think maybe that'd be a place to start, and then from there we go where we need to go.
I do want to reiterate, though, if people are getting concerns, that again, please get those to Kim Klatt, our HR director, as she investigates, even past employees that have been, that have had concerns and so forth. We are very thorough with that, and anyone that has filed a complaint, we would have that on record through our HR department. So as we all know, if you saw my complaint books, even for the residents, because we do serve almost all of the state of Wisconsin, that every concern has to be investigated and is reviewed by the state regulators. So it has to be very thoroughly investigated with a root cause analysis and with a conclusion. So we do have some very strict crossing your T's and dotting your I's. And again, we're an open book. Is there always room for improvement? Do people make mistakes? Are wrong, at times wrong judgments made? Yes, we all have room for improvement, but we continue to go forward and try to work together, because that is where we're going. I know it's continuing to be a difficult thing for many county members, even with some of the highway department and the healthcare center stuff that's going on with some, with some land next door and so forth. There's processes, there's philosophies, there's missions, there's, there wasn't tax levy dollar, ever tax levy dollars put into these programs. We're very fortunate that we are profitable every year. Even through the last 2 years with a lot of the struggles that we've had with COVID across the nation. We're trying our best to serve the people we serve and do the best we can for each and every valued employee. So, and now we'll go forward.
Okay.
Thank you.
Thank you.
I think for now it's a good place to leave it. And we will.
Thank you, Kellen.
Can I
Heather,
just
do you
ask?
need me? I was gonna say, do you need me to come down and babysit?
Oh my goodness. Well, yeah, they were doing pretty good, and then I don't know, they accidentally hurt each other, and yeah. Trying to do this meeting.
That's a good story. We've all been there.
They
Yeah.
accidentally hurt each other.
Yeah. I guess I just have one other question then. So we can talk to Kim Klatt, and then, I guess I would just like to move towards having, with the Healthcare Center Committee, move towards having it set up where we've got time for unbiased conversations, so that we make sure that we get the whole picture on everything. So you're saying that we should call Kim Klatt if we have concerns, and then is it possible for her to come to some of the healthcare center committee meetings, or?
Sure, and definitely Kim in the past has been present as we try to, part of the meet and greet and education on different departments. We've had our director of nursing there. We plan on bringing in our environmental services director coming up soon, so we can have some of those discussions. I know there was a parks meeting that I'm going to be attending coming up here soon with our maintenance director. So all we have to do is make that request through Dick, and we'll put it on the agenda.
Are you the chair of that committee?
Yep.
Yes. Yes.
Didn't know that.
Okay.
Oh, I'm sorry.
Okay.
What do I know? Nothing.
Okay. I think that'll take care of that for today. All right.
Is
Very
John
good.
coming down here,
Good
or is-
discussion. He is still. He's still auditing.
So we.
Oh, so there's still. God, why is audit so big today?
Because you're spending a lot of money.
Not me. I'm broke. I'm retired, remember?
Okay.
Social Security.
So I think we're going to move on from that at this point. Thank you for attending,
What parks meeting? Are
everyone.
you coming to our next parks meeting?
So we will. Do you want to?
Okay.
Let's see what we got.
I think Deb Sukala's next.
Well, technically, be Ann
Oh, no,
Hampel.
Ann's next. Yeah, I'm sorry.
She is. Oh, she is ready to go. I was going to give her 5 if we needed to, but we're good. Okay, so we will move on to item number 6, our real property lister GIS specialist position. Yes, please do. From part-time, 32 hours to full-time for discussion, possible action.
So I submitted, you guys should all have
Microphone.
the project initiation form.
Yes.
Thank you for doing that, by the way. Appreciate
Yeah,
it.
I wasn't sure of the process, so I'm kind of learning here as I go. I'd like to increase the RPL hours from 32
Could you
hours.
explain RPL?
Sorry,
for people
real
who are
property
listening?
lister.
Thank you.
32 hours to 40 hours starting January 1st, 2023. With our current workload defined by our land information plan and the increase in documents that are being processed, we could greatly benefit from the increase in hours, the help. And that's about all I have. The one thing I do want to add is if the job was vacant tomorrow and posted, it would be posted as 40 hours. So it is a full-time position.
You have budgeted for 2023 with
Not
this?
Not for 2022, but
2023, which I think is what this says.
It would start in January.
Yeah.
Yes.
Yep.
So you have budgeted for this in your,
I'm
in
trying,
23.
yes. I'm trying to pass it through there, yes.
Okay.
I'd make a motion to approve Ann's request to increase the, what is it? Real property lister, RPL, to full-time.
Okay.
Where'd
Motion
everybody
made by
go?
Jeannie.
Oh, there they are. I keep forgetting they're out there.
Heather,
Is there a
John.
second? Anybody?
I'd second it. I don't know if I can do that. Better not. Oh, muted.
Sorry, I'm on, yeah.
I made a motion to approve Ann's request for the real property lister to go from 32 to full-time. It's in her budget for 2023. And
I'll second or motion, whichever needs to happen. Okay.
Second.
We're good. We got a motion made and seconded, and Ron stepped out.
Do we have, where is everybody?
And John isn't in front of his computer either.
Could everybody please come back to their screens? Is Lori on our committee?
No, she's not.
Oh,
No.
is she still on? Lori, are you still on? It confuses me when I see.
Extra people? I know where John went.
Well, it can't just be me and Heather.
And me?
And you,
Yeah.
yeah.
Technically, I can vote.
Oh.
We do have a quorum, so I'll call the vote.
All those in favor?
All in favor? Nope. Ron has joined us again.
Oh, God.
So we have a motion on the floor, made by Jeannie, seconded by Heather, to approve the real property lister position going from 32 hours to full-time. On the floor?
Yes.
We'll call the vote. All in favor, say aye.
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 Opposed? Okay.
That was easy,
Motion
Ann. Thank you.
carried. Thank you, Ann.
These, Dick Miller's gone, but he started these.
They are helpful.
They are helpful.
They are very helpful. Okay, so our next item on the agenda is, I'm sorry, I'm trying to read two different things. Deputy Director position and Supervisor for Behavioral Health position from part-time to full-time. For discussion, possible action.
Human Services Board met on Monday night, so that's why this isn't in your packet. I apologize for that.
Oh, that's cool.
What time is it?
There we go.
Huh?
You see that? There's no
Oh, cool. Deb has very
Mind
fancy
blown.
staplers. It did work.
It works. I'm pulling it.
I like it way better than a staple, just so
I think
you
it's
know.
pretty cool. I don't know how you weld paper like that, but it's pretty neat. You'd have me. Okay, so Deb, go ahead.
Again, I apologize you didn't have this in advance. This went to Human Services Board Monday night. Your packets were distributed Monday, so the timing didn't match up. So the resolution you have in front of you is a budget resolution to do what the project initiation form asks for. Probably the two most interesting pages on the policy, or on the project initiation form, are the last two pages of it. So currently we have one person who does deputy director about 30% of her time, and she's a supervisor of one of our units, our behavioral health unit, the rest of the 70% of the time. And I'll hand that over to Hang on, I don't know, I got a project initiation, she can have the resolution. So what's happened is it's become very difficult for one person to do both of these well. And so we've done a lot of talking on our leadership team, which is all the unit supervisors and myself. We looked closely at this as we prepared the 2023 budget, and we're proposing to start this in 2022. But quite frankly, our department has grown in the last 10 years. Our budget that we're giving to you for 2023 is nearly $10 million. That's almost 90% more than the budget was 10 years ago when I started. Only 19% of that growth has come from levy, by the way, just so you don't think that all came from the county. We've increased our staff from 34 to 54. That's nearly a 60% increase. And although we did add unit supervisors who are subject area experts in the areas of growth that we've had, we haven't really added at the executive level leadership. So now I'm supervising more staff, I'm supervising more programs, providing more oversight, having to do more work. We've got all the compliance on many of the programs that we get. Intense reviews. I know the healthcare center talked about the level of compliance that they do, and I can assure you we aren't slackers in that ourselves. There's, again, developing new programs. Just trying to get a new program off the ground is just a heavy lift. Writing grants, we have really very little capacity. I do that in my off time. And so as a department that's grown so much, we really need assistance in that executive level support of this department, which is why we've brought this forward to you. The funding for it for this year, if you look at the budgetary page, is going to come from vacancies that we've had in supervision. In future years, we will get additional funding because it'll be in the administrative unit, and then we can draw down additional federal dollars for that. We're also expecting, you'll see in children and families and professional services, we're expecting a reduction in expenses because this deputy director is going to work with our staff to help improve the billing, to improve time reporting, ways that we can draw down more money without staff really doing anything fundamentally different. We're missing that opportunity, but we just don't have the capacity to explore that now. Furthermore, a lot of work is going to be done around making sure we place kids in the least and adults in the least restrictive setting. Right now, we have kids and adults that are very hard to serve. They go to placements. We have one individual that's sitting in a placement, has been there at least 3 or 4 years, costing us about $600 a day, sometimes $900 a day, depending where their need level is at. That individual has been there for a long time. They've stabilized. They could move to a less restrictive setting. And quite frankly, by not having time to sort through that, we in some ways are affecting not just their freedoms, but also their ability to become more independent. So we just need help in a number of those kind of areas. Again, we as the leadership team, we sat down, we really talked about this. I don't add positions without making sure I can have some money to cover it. There's no levy in this. I knew there was no levy. As a side note, the levy that we're presenting for 2023, we were asked to cut our levy by 1%. We've cut our levy by almost 3%, knowing that other departments, Krista and many other departments, are fully levy funded. They've got increases. There's no way they can cut their levy. So we felt as a good partner we needed to do that. And we built this position in our 2023 budget without adding to the levy and in fact reducing our levy. Okay. That's a lot of information. I know a few of you have heard this before, so I don't know what questions you might have.
Any questions for Deb or Erica?
I don't have questions, but I think you should brag about the decrease in kids in out of foster care in this county because it's phenomenal.
So since 2019, our number of referrals for child welfare, child abuse and neglect has gone up pretty dramatically. That same time period, our number of kids in placement has gone down pretty dramatically. That's very unusual because they're usually related. But what we've done, and again, as we as a leadership team, and we've got some pretty hard-working people on that leadership team, we're really looking at how can we serve those kids and and Erica's done a lot of work with this, and how do we serve those kids in the community, in their homes? How do we give them the supports they need to be successful in their homes and safe in their homes without having to take them out of their homes and create all that trauma for the child and their family. You know, you're taking a child from their home unexpectedly for a day or a month or several months or even a year. I mean, the trauma that we've inflicted on that young person can never, ever, ever be fixed. And so we're trying to find ways to keep that child safe, keep the family safe, serve their needs, and not cause that trauma. And it has really worked well for us. And we at one point in 2018 had 45 kids in out-of-home care, and now we're around 15. And again, that's a pretty substantial savings, but there's been an enormous amount of staff work that's gone into that to make that happen.
And out-of-home care is 100% levy dollars.
Exactly. Thank you, Jeannie.
Well,
it's truly amazing. I mean,
as long as the kids are safe.
Yep.
That's all that matters.
Kellen, can I ask a clarifying question?
Yes, please do.
So Deb, just to confirm for our sake, for recruiting purposes, so the current deputy director will become the full-time deputy director and will be recruiting for a full-time behavioral health supervisor?
Yes, she's paid at the deputy director, so she wouldn't get any compensation change. In fact, the pay for this would not be for a deputy director, it would be for the first-line supervisor.
And that's what Human Services just agreed to increase her hours.
Okay.
So instead of having one body, we've got two full-time bodies. I think everybody knows that. I just want to say it out loud.
Yeah. Okay.
And behavioral health supervision is oftentimes, you get reimbursement through the state for that position.
Yes.
A lot of your positions are
Yeah.
reimbursable.
Yeah, a lot of our billable programs.
Okay.
Heather,
Heather,
did you have a question?
Yeah.
No, I just couldn't hear what you said a minute ago. That's all.
Oh, I just clarified that we have one person doing two jobs. This request is to have two people doing the two jobs. So I think everybody understands that. I just wanted to be really clear.
I'm all for it if it's in your budget and it would help make it a more productive process. Then I would make a motion to approve it when the time comes.
Motion made by Fritsch, second by Johnson. Any other discussion?
Yeah, and one of the things I brought up at Human Services is having a director, a deputy director, and supervisors. We would have, Deb would be doing director stuff, and in my vision, Erica would supervise supervisors, and supervisors would supervise staff and pull Deb out of the day-to-day interactions with staff and have clear boundaries on who's responsible for who. And I said that at the Human Services Committee too.
Okay.
So.
Anything else before we call a vote? Questions, discussion?
They better come to you yet, don't they?
John looks like he wants to say something, but I will call a vote. All in favor of approving the separate Human Services Unit Supervisor and Deputy Director positions signify by saying aye.
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 Opposed? I think motion carried.
Is this, you're bringing this to exec finance? Okay. Okay.
Do you have an official one you want us to sign?
I'll be there Monday. I don't know if you want me to sign then or how that works.
I can put I put an X by your name. Heather, I put an X by your name via
Thanks,
Zoom
Jeannie.
for you.
I
and
wish it. Sorry, I had to be out of town this week.
Yeah, somebody else was not present either, but was on Zoom. Oh, Bridget.
So she put Heather's X on your body.
Thank you.
No, I didn't.
No, my name's up above.
He's the first. He's the top banana.
I looked at it the first time too, and I thought they were just calling me Zoo, so. I wasn't sure.
Okay, our next item up for discussion, we have item number 8, resolution for Trempealeau County Employee Handbook and Policy Manual. Up for discussion, possible action. Heather, what do we have here?
That's right.
All right, so at our last meeting.
You have it. You gave it to us.
Yep, a draft of the handbook policy manual was distributed. My hope is that this committee had a chance to look over that and make any comments or suggestions. Before it does go to the full county board, if you don't mind, I will read aloud the resolution. Whereas the Trempealeau County Board adopted the current employee handbook effective 4/20/2010 and revised the handbook on 1/1/2013, and whereas multiple policies within the handbook have been updated and approved as addendums to the handbook since 1/1/2013, And whereas multiple standalone employment-related policies were not included within the handbook and employees would need to attempt to locate them elsewhere for reference, other times the handbook would offer a condensed version of the policy and would refer to the full policy for additional details, and employees would need to attempt to locate the other version for other details. And whereas having the policies in multiple locations and versions is confusing to employees and creates liability issues for the county, and whereas the document as a whole has been updated to include a new cover page, table of contents, updating yours to employee there, and updating his or her, he, she to employee there, and whereas the revised employee handbook pertains to all employees of the county, however, those who are covered by a collective bargaining agreement have other personnel policies and practices contained in a collective bargaining agreement that may supersede this employee handbook. Now be it resolved that the Trempealeau County Board of Supervisors hereby adopts the merged and updated employee handbook as one document effective August 15th, 2022.
And I went, I'm sorry.
Go ahead.
I went through the handbook. I didn't see anything glaring that was an issue. It looks really good to me. I know you guys really shed a lot of blood, sweat, and tears over it, so it was a huge undertaking. So thank you for your hard work.
You're welcome. I would like it noted that it's definitely not perfect by any means, but it's much better than where we were at. I think from here, it's really to now digest and look at each policy individually to make those updates as appropriate, but at least we have one cohesive document that employees can refer to.
Very good. Move to adopt by Johnson, second by Nutter. Is there any other discussion from the committee? Okay, seeing none, call this to vote. All in favor of our resolution on merging the employee handbook and employment policies, say aye.
Aye.
Opposed, same sign. Motion carried. We will move this forward for county board. There you go, Jeannie. Excuse me. Our next item on the agenda is our base compensation administrative guide update for discussion, possible action. And we have that in front of us.
And we aren't going to hear about health insurance until October, right?
September.
Oh.
Usually next month,
Okay.
if I'm not mistaken.
The state will let us know. Have you heard any rumblings from anybody else about what it might be?
So WEA Trust has announced that they will no longer be an entity, so to speak. So they are apparently coming in with a new plan, which is our Mayo Clinic plan. So we will see what they release for that. We have not been made aware. The board is meeting on August 17th at the state level to discuss what premiums are going to be.
ETF?
ETF
Okay.
is, yep. So we'll know more after that meeting. It usually takes a good 2 to 3 weeks before we get anything.
First part of September, hopefully you know
Yeah,
something.
we'll be crunching numbers. So.
Okay.
Maybe it'll go down.
Yeah.
I'm not hopeful.
We're dreaming on that, I think.
Be nice, but, okay, so on the base compensation administrative guide,
Yes, so you have a copy of the base compensation guide in front of you. I do know we just updated this in January, however, reason for updating it at this point, it has become extremely difficult from an HR perspective to make a consideration as to what is a new job and what is a reclassified job to try and differentiate the two. So what I'm proposing is to eliminate the job reclassification section of this policy manual and going forward call them just simply revising jobs. I think with our current job market, we're going to need to be more flexible with the ways that we're conducting county business and filling positions here. So I think this would be one way to help alleviate some of those concerns. And this would really open it up to departments if they do have new ideas of how to structure their department, they can do that at any time. It won't be an administrative burden on HR's end. We're really just passing papers to Carlson Detman. They're giving us that recommendation on a grade placement. And then from there, it's to go through, of course, the committee processes as far as approvals go.
Okay.
So that is my recommendation at this point. Do keep in mind, it is about $275 to review each position at that time. I have a professional services line item within my budget as it stands today for those costs to be allocated towards. So I know we briefly talked at our last meeting, but at this point, I would recommend that stay in HR's budget.
You would recommend that stay in?
Yep. I would
You're
just,
sure?
yes, I would just like the committee members to be aware that every time we are looking at these, it does cost us that $275.
And that was why I know at one point we talked about having that come from the other department.
Right.
What happened to that?
Is there a specific reason that we aren't going to pass that on?
If this committee would like to, we sure
I
can,
would like to.
could look at it. I do
If-
have that, like I said, $5,200 in my budget currently for those
Can you put
costs.
that as a action item on our next, because I would vote yes to have
it passed on.
to have it
And
passed
have-
on to the department that wants to revise it.
We can
You're
definitely
not
look at it.
asking to do it.
I think that there needs to be,
Accountability.
I think it's going to, I'm afraid, my fear is that we're going to get consistent, repeated, well, I want to do this.
Sure.
Well, I want to do this. And then just keep revisiting willy-nilly. We don't need or want that. Not that our directors would do that, but I just don't know that there's a reason that we need to keep paying for that for them to do what they want.
Sure.
So, that's my personal opinion as well, Jeannie.
I agree. I mean, I think.
I'd like to hear from other.
I agree. I don't think we would want to keep paying.
I think that if, John, do you have any comments?
To me, it's expensive. Well, I don't know. We and I both are in the highway department. We know that the whole dang study that we did years ago, it's just constant conflict out there. But we used to have four pay grades or 4 different categories for pay, and now there's a ton of them. So.
Well, this is more for just general reclassification.
Right.
So I don't think that this is any kind of a major change. It's just be allocating where those dollars come from.
Right.
And it would be well, I would propose, I'll say it, is that the fee that we pay to Carlson Detman would be due from the department that is seeking the reclassification.
And I can include language in the process section of this guide
To
to
do
include that
that.
language.
Yeah.
Yep.
I would like to amend it.
If that's a
amend the
motion,
resolution.
I don't think we can vote on it today, can we? Can we? Oh! I would like to make a motion that when a department asks for a reclassification or a restructuring of a position within their department, that they are responsible for the $275 fee from Carlson Dittman.
And when would that be effective?
Effective January 1st.
Okay.
I second that motion, Jeannie.
So can I have a follow-up question? Are we over budgeted in that already this
Yes,
year?
that is the
I
one.
would say it's effective. I would rather do it immediately.
Okay, all right, I'll make it effective September 1st.
There's no sense to keep,
I retract my start date to September 1st,
2022.
2022.
And I would just like to clarify for the group too, that not every job, as we change
Requires
job,
this.
as we
Yeah.
change
Right.
job descriptions, does not. It's only
Yep.
if there's a major change to the
Okay.
job.
if there's an expense incurred,
Correct.
that's where we would
Yep.
charge the department.
Okay.
I do have a clarifying question.
Yes.
The issue that Krista brought forward was to remove the reclass section from the policy. So
Okay.
would this fee be applicable if that section's not even in here? It is?
Yep,
Okay.
because it would go underneath our, instead of reclasses, we'll just be calling it revising the job, so it'll just
Okay.
go in this
Okay,
section.
Just wanna
so
make sure I
still go
record
into that
correctly.
then.
Yep.
Okay.
Okay.
Good question.
So we have
Does
a,
John get what we're talking about?
I'm not sure,
Okay.
but he's not there and he's busy. So he is busy paying the bills, so to speak. Any other discussions on this before
No,
I call
good
the vote?
idea, thank you.
All right, I'll call the vote. All in favor of updating our base compensation administrative guide, signify by saying aye.
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 And that includes
Aye.
what I said.
Yes.
Okay.
Opposed? Motion carried. We have updated our base compensation administrative guide.
Okay.
Very good. We're doing good here.
Well, did you see number 10?
Yeah, I did. Okay, our next item is number 10, our 2023 cost of living adjustment for discussion, possible action. This is what we've all been waiting for.
This is what everyone's been waiting for, yes. So I did provide a handout to this committee. It's quite a few pages long of just some data and numbers that I have pulled together. So for anybody watching at home or from their office, just wanted to kind of rattle off some of these numbers. So as everyone knows, at the last month it was discussed that employees would potentially be getting a step increase. That is what each department has been budgeting for 2023. As a reminder, if an employee is advancing between steps, so from step 1 to step 6, they'll be receiving, it's a 3% increase between step, and if you're between step 6 through 16, it's a 1% increase. So once you hit that control point or the midpoint, that does slow down. Again, a little bit of history on what we've done for cost of living adjustments in the past. 2022 is a little bit different since we just went through the wage study. Employees were placed at their new grade and then at a step that provided at least a 2% increase. In 2021, employees received a step plus a 1.25% cost of living. 2020 was a step increase in a 2%. 19, step increase 1%. 18 was a step increase 1%, and 17 was a 1.6 and a step increase. As far as the research that was conducted to try and come up with a recommendation for this committee, I did look at the Consumer Price Index. Currently, that for the month of June was at a 9.5% increase. Also looked at the Employment Cost Index that's released by the Bureau of Labor Statistics. That was at about, 5%, I believe it was, increase overall for benefits and wages. Would just like to remind this committee as well, it is getting extremely difficult to recruit for positions in this day and age. We're lucky if we get 4 to 5 applicants for each position that we post. So for us to stay competitive in today's job market, my recommendation to this committee is a 3% increased cost of living. And I do have that number broken out for you on the last page of what that is going to cost. I have also recently gotten some data from other counties. This was not included in your packets as this has kind of been going updated day to day. We are seeing other counties doing a cost of living increase anywhere from a 2 to a 6.8% cost of living on top of a step. So I would say 3% from all the other counties' data that we've collected is about average. I have data from 23 other counties. If there's any specific counties that this committee is looking for, I can definitely rattle those numbers off. But
What's Eau Claire's? Does I say no?
Eau Claire's is doing a 2.5.
Okay.
Jackson County is a 6.86 plus a step.
Yeah,
Jackson, yep. Door County, which is similar in size to us, they're looking at anywhere from a 3 to a 5%.
How can we do this when we don't even know how much money we're gonna have to fill the budget as it is? You know.
That is the difficult part.
I mean, you can't legally borrow for operations. So what this is gonna cause is, we're gonna have some layoffs or something if we don't.
You think?
Absolutely, because there's just not that kind of money going. We got a 9 increase in new construction was only 0.93%. So that's as much as we can go up on our budget is 0.93, less than 1%. That's not much.
Well, I'm a big fan of human capital within this county. And if we don't, I mean, how long is, I know that there's a human services supervisor position that's been open for how many months? May, June, July, and still not filled?
We are in process.
Okay.
We're
so
really
that's,
close.
You know, that's a CPS supervisor position that's been vacant for 3 months.
Yep. I do just want to note too, so on the proposal that I have in front of you, it includes full-time, part-time, and part-time fill-in employees. Our union folks are not included in that number, as our elected officials and highway staff are not included either, since that cost of living doesn't come from levy dollars. We can also recoup additional funds from human services and child support. I don't have those calculations built into here. That takes quite a bit of time to break out all those numbers.
I know that human services is dumping $400,000 back into the general fund.
I think it's more than that, more like
And
470 or
they cut their
570.
budget by 2.3%.
Which kudos to them, gotta say.
So what are the wishes of the committee?
Well, I support your 3%.
It's a tough decision.
I wouldn't go lower than 2%.
But you said Eau Claire went 2.5? What about lacrosse, you know?
I don't believe I have data. I don't have data on lacrosse.
Jackson was 6%.
Well,
Door was,
They were probably so far behind already, though. So,
I think they just did a compensation study, if
yeah.
I'm not mistaken, within
That's
the last
probably
year.
why theirs is up so much, so.
Dork was they're still toying with 3 to 5%.
you did have a 2.5% here, right?
Correct.
Yeah.
Okay, I would make a motion to do the increase of 2.5%.
We have a motion on doing 2.5% for wage increase.
John, did you say this isn't in our budget though? Or Krista, did you?
Well, we haven't even started the, budget yet, so we don't even know what we're gonna have.
All departments, though, have put a cost of living increase in their budgets. They have not?
No, so each
There's a
department
step increase.
A step increase.
budgets for the step increase, and then the cost of living comes out of the contingency fund. So what we do
Right.
is we give this rough estimate number to Paul, he passes that number on to exec finance, and then they try and work it within the budget.
This just could, actually, it's just basically just this committee's recommendation. If it gets
Correct.
down to exec finance and we can't do it, we can't do it. It'll change at that point.
It does?
Okay.
Well, if we can't, if we don't have the money, we can't.
It ends up with the budget. Exec
Yeah.
finance doesn't overrule our decision, correct?
No, but we'll.
Right. If you want to slash and dash employees' benefits at that time, fine, but I would support a 2.5% increase.
Okay, we have a motion on the floor still for 2.5%
I would-
increase.
I would support it if the budget allows. I don't know if that has to be a separate motion.
No, that's,
We have to make, I think we have to make a decision, and then that's what it'll be, and then if exec finance, when they're doing the budget hearings, decide to cut, then they will do that.
Okay.
Cut employee.
I would say, based on that, I would agree, I would second it.
okay.
With the understanding, obviously, it's gonna be up to them if they've got the money.
Whether we have the money or not.
Right.
Yeah, okay.
Yeah.
We have a motion
I
made
mean-
and seconded.
And then it just based on what people are dealing with today, I did see that inflation went down, and people were surprised. It's 8-point-something% now, and gas prices have been going down for 67 days in a row. So, but I think our employees and all humans right now are suffering, so I can't imagine having them suffer more.
Yeah, and I agree with that. It's not a matter of that, though. To me, it's a matter if we've got the money to do it.
Right. So you guys can figure that out.
It's kind of a combination of everything, which is why this is a difficult decision, so.
Yeah, this isn't set in stone. It's just a recommendation from this committee,
Right.
basically.
Okay. Any other discussion or comments? If not, I'll call for a voice vote on, the motion is to do a step increase and a 2.5% wage increase for 2023. All in favor, signify by saying aye.
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 Opposed? Okay, motion carried. That is what we will pass on. Our next item is our turnover in recruitment report.
All right. To date, we have filled 35 full-time positions. The one that's been updated since your packet's been turned out is we did fill the captain position within the sheriff's office. And then we have filled 8 limited-term positions and 5 part-time fill-in positions. Are there any questions on the turnover report?
Who's the captain's position?
The captain's position is now filled by Dave Lingen.
Oh,
Wow.
good,
Cool.
good for Dave.
Good for him.
Very cool.
Congratulations, Captain Lingen.
Okay, yeah, well, very good. Next, we have, anything on events for HR?
Can I just ask a question? Is Highway
Absolutely.
Department, are they good with positions now?
We do have one vacancy of equipment operator
Okay.
that we still need to fill out at the highway. That'll be
Okay.
coming probably next month. We'll
right.
hopefully have it filled, so. Events, I will be attending civil rights training next week in Wausau on Wednesday. As just a reminder for this committee, I serve as the civil rights coordinator and I administer the county's civil rights action plan that we do every 3 years. So I will be attending training next week on that. We just updated our civil rights plan for this year, but it is a requirement that I attend training just to stay up on top of those regulations. We have a benefit renewal meeting scheduled with the Insurance Center for August 23rd. So we'll be renewing and looking at benefits, all of our voluntary benefits. So short-term disability, our accident, cancer, critical illness plan, short-term disability, life insurance plans. So we'll be meeting, it'll be myself and Kim Klatt, and then Kayla will be attending as well.
And we're doing well with our workman's comp, that we haven't dug into that?
We can look at that when we get to budget. How does
Okay.
that sound?
All right, okay. That
And-
doesn't sound good.
It's not bad.
Okay.
And then, like we stated earlier, our 2023 health insurance rates will not be released until after the board meeting that ETF meets on August 17th. So we will bring some rates for you to consider at your September meeting. So stay tuned on those.
Okay. Very good. Okay,
brain
so
is full
that,
now.
we aren't done
full.
yet, though.
I know.
Our next item is 13, our 2023 budget proposal.
Yes, so I have included in your packets the 2023 budget proposal for the Human Resources Department. In addition to our EAP budget, the county's property and liability budget, as well as the county's workers' compensation budget. So we'll start by going through the HR department budget. Not a whole lot of changes to it from last year. You'll see there is an increase in my wages and salaries due to including the step increase for the 3 full-time HR staff that are within my office. You'll also see an increase in the fringe benefits, again due to that increase for the 3 full-time staff. Did have a decrease in our telephone and fax budget. Again, just looking at numbers of the past couple of years. It's not much. However, to offset that cost, I did increase our publication legal notices line item budget, increase that to $150 in addition. Reason for increasing that was due to the need to purchase additional federal and state labor law posters. Currently, we've been purchasing as much as the budget allows us to purchase. We do need a total of 8 posters for courthouse, sheriff's office, and then each highway location also requires that a set of posters be displayed. So we've been buying the nice laminated ones. It's easy, you just throw them up and then they send us a new one as each labor law poster updates. For the ones that we couldn't purchase, we were printing them off and laminating them and sticking them up. So this would allow for us to simply just buy the posters, put them up, and be done for the year. Other than that, there are no changes to the overall HR budget. So are there any questions? I would like to add in as well, I may potentially need to tack on an additional cost on my professional services budget. We do utilize a program called Employee Navigator for all of our benefit enrollments for voluntary benefits offered through the Insurance Center. They are still looking at numbers for that, and they'll have numbers at our August 23rd meeting when I meet with them to pay for that platform. Last year, they waived the cost for us, as I was not thrilled with the platform, but it is really our only option at this point that's affordable. So we will see what they come back with for numbers. So if this committee is okay, I may have to tack that cost on to that line item. Any questions before we jump into the next 3 budgets?
Not right now.
Okay. The next one is our Employee Achievement Program budget. I know we had a presentation this morning, so this committee had approved a 3-year or excuse me, a two-year contract.
I was gonna say, 3 years.
Two-year contract. So I did budget in the sheets that you have here for that $9,500. That will be going up slightly from the 91 that was budgeted previously. The next budget that our office takes care of is the county's workers' compensation budget. We do not have hard and fast numbers on this, and this one is really hard to predict with our claims. So what we have done, let me pull up that sheet. There's a couple different nuances to the work comp budget. So we look at claims. We do a 3-year agreement with them that we're currently in with. So we are locked in at that. We do all of our claims handling through Convergent Claims. They used to be Minutemen of Wisconsin, if that rings a bell.
That, yeah.
Yep, they're now through a company called Convergent. So the cost for Convergent Claims includes a $500 account fee and then $27,100 annually that we pay as a TPA or third-party administrator fee. So that number is very constant for next year as well as the last 2 years. We also pay a loss control fee, which again, we have a 3-year agreement locked in with Willis Towers Watson through January 2024. That loss control service includes our consulting services fees, which is $21,800 that we look at annually.
I have a little question.
Yeah.
There was a time when, I think his name is Dave, when he used to come here and meet with us.
Yep.
And we would get information from him about cases that were still ongoing.
Sure.
So it was more clear in my head what we were still paying out through workman's comp. And is it possible to get that from him?
Absolutely. I can see if he's available to present at our September meeting.
Okay, because that's just helpful for me to see, you know, are we still paying a claim from the highway department from 10 years ago? You know, are we still, I mean, it just helps me have a better picture of the health of our plan and the health of the people that we're serving. Okay.
And I do get a monthly loss run report that shows some of that data. So if you wanted to stop up, Jeannie, I can definitely show that too. But I know
I'm
David,
a visual person,
Yes.
and that stuff is really helpful to me.
David has presented in the past, and I will see if he's able to come to our next
Great,
meeting.
that would be good. Thanks.
The next two budgets, or the next two line items within the work comp budget, I would say are the most unpredictable. So our excess work comp, again, I won't have a number until we do our renewal for that. But the excess work comp is really protecting us if we do go over a certain number on a claim. So for 2022, our specific retention was $750,000 for employees in emergency management, and $500,000 for all other employees. This is one that we do renew annually. Again, I did an estimate for 2023 based off of a 2% increase in payroll and then a 10% increase for the policy as a whole. So you'll see that number budgeted. And then the other unpredictable one, of course, is what our claims are going to be for the year. I estimated our claims based off of the last 3 years' worth of claim history and then tacked on approximately 25% on top of that just due to increased medical costs. Costs are rising overall. So that was the number that our TPA gave me to use as a number to budget for.
Okay, I'm sorry. I have a lot of questions today.
That's okay.
Is the healthcare center under this workman's comp?
Yes, they are.
Okay.
We also pay for all of our employment and pre-employment screens out of our workers' compensation budget. So this includes drug tests, audiograms, which are hearing tests, and then all of our psychological evals that are done for our sheriff's office. Deputies are also paid out of this line item.
I just have a quick question. If the healthcare center workman's comp comes, is that coming out of the county budget then? That's where, or maybe we'll get a better picture when we have that other special meeting. It's confusing how some things are being covered by our HR department, if that's what I'm understanding, and other things aren't. I don't know if there's a way to explain that or if that would be better explained at the other meeting.
Yeah, I can definitely help clarify that. So as far as the claims handling process goes, the healthcare center takes care of that piece on their own. As far as the bill paying goes, I take care of that for ourselves and the healthcare center. But what happens is I get all of the invoices at the beginning of the year for the workers' comp and property and liability, and then I allocate those funds out to highway, healthcare center, and then the snowmobile club for our property and liability insurance. So they do pay us back for their share of premiums.
Is it their share based on coverage or share based on use?
It is, so for the numbers that we know for certain, of course, I do a breakdown of that, and then claims, we do just a very rough estimate of what we can budget for.
So all three of those entities pay you back?
Correct.
So the healthcare center pays you back, the
Highway.
snowmobile club pays you back, and highway
Yep.
pays you back?
Yep.
Okay. Pays us.
I'd like,
yes.
I'd like to just get a list of that so I have that visual copy if I can of how that works and what departments pay back.
So, yep, Heather, if you look at my budget request for the work comp line
Yeah.
items there, I do have them broken out.
Okay, all right, I'll have to look in the packet
Second
again
to
on.
last.
No numbers.
Second to last has all the good numbers.
Okay.
First two pages are just kind of explaining what the budget entails.
And the only reason I asked that question is I know that there's lots of stuff that, like back injuries at the healthcare center for lifting and things like that. That is covered under ours, but they pay you back, they pay us back.
At the beginning of
So
the year.
really, they're paying for their own.
Not necessarily per claim.
Right.
Right.
It's so complicated.
It is. When our previous work comp, our previous loss control manager was here with us, Brian Margan. I'm not sure if you remember him. We had briefly discussed charging back each department for work comp. That is something I would like to explore. I'm not sure if it will happen for 2023, but it really puts accountability on every single department instead of just highway, healthcare center, and snowmobile club to take some initiative to be safe and take those safety measures for all of their employees.
Right.
So,
because I know the surveys that happen within the healthcare center look at all employee injuries. I mean, they're very scrutinized. Right. Okay.
Heather, you have something?
Would that be, if that's something you would like to explore, is that something that would end up going to exec finance? Because it sounds like a budget type of thing.
yes, it would be something that each department would have to budget for within their budget. So it won't be for 2023, but maybe for 2024 we could look at exploring.
So the snowmobile club is its own deal. So
right,
I
and
don't,
that's just for property and liability insurances.
Okay.
Yep.
All right. Not for if they fall off their
no,
snowmobile
not
and
for work
hit
comp.
something. Okay, we don't care about that.
Right.
No, yes, we do care about it. We just can't pay
We aren't
for
insuring it, yes.
Your private health insurance or whatever covers that.
Yes.
Okay, I got it now. All right.
Yep, last budget we'll talk about is the property and liability insurance. Again, we're in progress of determining what those rates are going to be. Won't receive them until later in the year. Did budget for a 6% increase to our property and liability insurance based off of our actual expenses from 2022, which was $459,000 approximately. Again, those premiums billed out to Highway, Healthcare Center, and the Snowmobile Club. And you can see a listing there of all the different policies and endorsements that we do pay for as a county. You may notice on the budget sheet, it looks like there's a reduction to the levy on this number. In essence, it's really not. I just changed the way that I budgeted for the cost back that we're getting from Healthcare Center and Highway, as well as Snowmobile Club, to try and get it a little bit more exact for this year. So it looks like it's going from 213 to 200. But it is still a 6% increase overall.
Holy mackerel.
Yep, that's what I had budgeted for. I have started to get renewal contracts already for our liability, so I would assume property will be pretty shortly after.
Was that highway department, for you highway department people, the truck that got rolled over, was that a total loss to that truck, or?
It won't even reach our deductible.
Oh, really? Wow.
And the towing. But it's still less than our deductible, and the truck's on the road already.
That is a miracle.
Yeah.
Did they ever?
It went, actually, as you hear the story, he went in slow, and then basically the load shifted, and he just went over on his side. So.
But did they ever find the guy who caused the problem? That his insurance should be paying for this?
So.
If you're out there in TV.
Nobody got hurt, and it was a minor expense.
That's right. Well,
unfortunately.
That's really good news.
Yes. $5,000 deductible, and he said we won't even reach that.
Wow.
What is our deductible? Or do you know?
What, Heather?
5,000.
Do you know what, 5,000?
Yeah. So it won't be anywhere near that. So good news there.
Is that what the deductible is for like our vehicles too? Wow.
Yeah.
Oh, mackerel. Some of our cars aren't even, well.
No, they should be.
Yeah, we have some new ones.
Yeah. For the most part, we had nice
Oh.
stuff. Yeah.
I wonder what my insurance would go down if I had a $5,000 deductible on my car. I'd be really
Call your
cheap.
insurance guy.
I wouldn't want that deductible myself, but.
Me neither. Me neither.
Well,
That's why we pay so much.
Right.
Wow, nice job.
okay. Any other questions, comments on the agenda for Krista?
I'll second.
Okay, motion made and seconded. Any further discussion? If not, all in favor of approving the 2023 budget as presented, signify by saying aye.
Aye.
Opposed, same sign.
It looks like somebody's asking questions on the thing. Can anybody read those?
That was me earlier, because I was trying to talk, but I didn't want to interrupt, just kind of.
We
Oh,
can't
okay.
see them.
I just saw that.
I think you go in the mouse, because with my job, you probably go to that computer.
Yeah, we can.
Oh, that would be
I think
true.
that's-
Okay, thanks, Heather.
Would that be worthwhile?
I need some caffeine. I don't have any in the courthouse.
No.
Yeah, can we take a little break?
Okay, we'll take a 10-minute break before we continue, which actually is closed session. So TV, you can probably be off the hook. Thank you.
Heather,
Thank you, Kevin.
I'm getting.
No, I was thinking it before, but we've been moving along pretty good.
When I get home.